So much.
Please do, thank you.
Okay, in the meantime, this is very serious. It is the most preventable cause of disease in Ireland. A very expensive habit. National Smoking Day today. Can you kick the habit? National No Smoking Day. Well, here to help us is pharmacist Kathy Maher. Hello, Kathy. Kathy, can you help me with lots of other things as well as smoking right now, because I nearly choked there. It is a very serious issue. 6,500 people lose their lives to this every year.
Absolutely. Loads of conditions, diabetes, it worsens, there's lung cancer, emphysema, COPD, bronchitis. About 85% of all people that have COPD have smoked or are smoking. It's
Do you know the thing is, Kathy, it's a very, very difficult habit to break.
It is. Nicotine itself is a chemical, and it's very, very addictive. It's physically addictive. And people also find that it's psychologically addictive. So in times of stress, people that maybe have given up successfully go back after a few months because they've maybe had an emotional time.
Okay. A lot of questions, Kathy. I'm going to try and get through a few here. A viewer got in touch. I'm 52. I've been smoking since I was 12. Is it too late to stop smoking?
No, it's never too late. And in pharmacy, we'd always hear this. No, the damage is done. But
that's not true.
If she stops within a year, her heart attack risk is well reduced.
Excellent. Okay, let's take a look at some of the products you've brought in to help us today. Let us begin first with patches.
Patches, two types there, a 16-hour patch and 24-hour patch. Depends, again, if someone smokes first thing in the morning or if they've had sleep disturbance. But again, we would advise which is the best one.
Okay. Moving on next,
the gum. There's a 2 milligram and a 4 milligram. And the choice of any nicotine product depends on the amount that a person smokes. If they smoke less than 20 a day, they go with the 2 milligram gum. And there's a very unique technique of using them, so we would always make sure that people know how to use the gum properly.
So they're for somebody who smokes under 20 a day. Now, after that, you're going to take a look at the microtabs. Now, what are they?
Microtabs are very effective. People sometimes don't like chewing gum. They don't like to have the gum has to rest in the mouth. The microtab dissolves under the tongue, so that's how it gets into the bloodstream.
All right. And the inhaler as well after that. That's like a pretend cigarette, isn't it, for the world, really, isn't it?
That's very good for people who have hand-to-mouth. The habitual. If you think someone smokes 20, 30 a day, they're doing that 70,000 times a year, this hand-to-mouth action, so it's a very strong habit to break.
And I think a lot of people, and when you think, I'm just going to show this little thing, when a lot of people who are trying to quit smoking, the most difficult thing is to break the actual physical habit, as you said. So this is you actually like taking your mouth and you can just have a few puffs of it.
That's only suitable for people that smoke less than 20 a day. So even for that hand-to-mouth, we would say a bottle of water. It's very effective for people too.
Oh, really? Okay.
They find they might reach for biscuits. If we say get a bottle of water, you're still treating the hand-to-mouth action.
It's actually a very good idea, very simple. What's next here on our list?
The next we've lozenge, and they work in the same principle of the gum, and they will all work to treat cravings. So if people have a craving and they can't wait 3 minutes, the craving to pass, they treat that.
Now, talk to us about Champex, because it's been in the news a lot since it came on the market a couple of years ago. It is prescription only. What is in it and how does it work?
It's a drug called varenicline, and it works. It competes with the nicotine for the receptor in your brain, so your brain eventually then doesn't want nicotine anymore. The patient would start off on Champex and they'll smoke for the first week to 10 days.
With the Champex?
With the Champex, and gradually their desire or the craving for nicotine goes. It's not for everyone, it's prescription only. That has to be prescribed by the GP. There are side effects associated with it, so we would just suggest that they really talk to their GP for that. With any of the products, though, as long as there's support of a healthcare professional, people will give up more successfully.
Okay, very good. Now, Noreen got in touch with us here. She said this is the first Ash Wednesday off cigarettes in 32 years. Often 3 months, now 3 months, she said. Went to a hypnotist in Belfast and it was easy. Well, you know what, Noreen? Fair play to you. But I guess there is a time for everyone to quit, and this was your time. And I guess, you know, you've probably seen this as a pharmacist.
Absolutely.
When you make up your mind.
When you make up your mind, and obviously with the hypnotist, you would also have got some support.
Do you agree with these complementary therapies like
if they work,
hypnotherapy?
If they work and they get people off cigarettes, it's best for their health, absolutely.
What do you think is the best of all of these, if you were to pick one? But I suppose you can't really, Kathy, because it's different for everyone,
It depends on the level of addiction. If very, very addicted people will smoke within 15, 20 minutes of getting up in the morning. So it depends on the level of addiction, the amount they smoke.
Okay. Now, just one more here. I'm 52. I've been smoking since I was 12. Oh, I read that one already. I'm 18. I've been smoking since I was 14. I really want to quit, but find it hard. I get very emotional, will start crying for no reason. How could I quit without stressing myself out?
For herself, she's only been smoking for years, so there's not a huge amount of damage done, but still she needs to stop. I would suggest she gets in touch with her pharmacist or GP and gets regular advice from them.
Excellent. Kathy, thank you so much for being with us today. Kathy's tips on how to quit smoking, just pop onto our website, the Airtel page 340. Now, that's all we have